Hi, my name's Tim and I'm a CBT therapist. I just want to take a couple of minutes today to talk about neurodiversity and more specifically about ADHD, just to help us all think a little bit differently about how our brains potentially work. So neurodiversity is the idea that there's a natural variation in the way that people think, the way that people process information, and the way that people experience the world. So in the same way that we all have different physical traits, we also all have different brain types and different ways of thinking. So if we think of neurodiversity as like soil from which many different mental health experiences can grow, then that soil in some people might nurture creativity, curiosity, ability to kind of focus really deeply. It can also potentially then make people more vulnerable to things like anxiety, to overthinking, OCD, and potentially social difficulties. For many neurodivergent people, it often feels like the world has been designed for neurotypical people. So we've got lots of systems and routines and expectations that don't quite fit how neurodiverse people might think and might function. So over time, that mismatch potentially leads to a lot of struggle, a lot of burnout, and sometimes a lot of shame. And it's not because of who they are or who we are, but because they've had to constantly adapt to a world that wasn't built with neurodivergent people in mind. So rather than seeing these traits as defects or personal defects, it's much more helpful to understand them as responses and adaptations to living in a world that isn't always designed for them, or doesn't always suit them in that moment. So when we talk about ADHD, I guess a lot of people still think about the stereotypical naughty child who just can't sit still. But ADHD is much more broader than that, much more complex than that. So ADHD affects the ability to regulate attention, it affects motivation, it affects impulse control, and definitely has an impact on self-esteem. So it's not about having a short attention span, it's about having an interest-based attention system. So people with ADHD can often focus intensely on things, so be hyper-focus on things that engage them and they find interesting, but may struggle with things that are more routine and more repetitive, or sometimes maybe seen as more boring. ADHD also looks different across different individuals and genders. So lots of adults, often particularly women, might go undiagnosed till later in life, mainly because a lot of their challenges are often more internal. So things like overthinking, emotional sensitivity, and burnout, rather than necessarily being outwardly hyperactive. So being more neurodiverse aware really means just shifting that focus from what's wrong with this person to thinking more like what does that person actually need to thrive. So looking for support and techniques that are designed for neurodiverse brain types is something that's really important. So as a CBT practitioner myself, that often means adapting the more traditional therapy models to better fit a person's particular brain type and particular experiences. So often using more visual, more practical and more structured approaches that focus more on strengths, focus on building self-compassion, and focus on working out how that person can motivate and use and regulate their attention, rather than just looking at symptom management. And so CBT can be particularly effective when it helps people with ADHD develop awareness of their unique thinking and behavioural patterns. It creates realistic systems for motivation and organisation, and challenges the unhelpful beliefs that potentially develop from years of feeling different or not feeling good enough. So when we embrace neurodiversity in therapy or workspaces or just inside society in general, then hopefully we create environments that allow everybody to contribute their best. Thanks for listening. I hope this has helped you to learn a little bit more about ADHD and the wider neurodiversity movement generally. Thank you.